Hi, I'm Mary Beth Cadlick, the Program Director and an Occupational Therapist in CANDO, the Center for Autism and Neurodevelopmental Disorders. We are also affiliated with the Eunice Kennedy Shriver Center that is part of the UMass Medical School.
And hi, I'm David Cochran. I'm the Medical Director of CANDO and also a child psychiatrist providing treatment for kids in the CANDO Clinic. So the CANDO Clinic has been open for approximately 6 years now, and we opened in central Massachusetts to provide a service that was sorely needed in this area, which was a specialty clinic specializing in evaluation and treatment of children, adolescents, and young adults with autism spectrum disorders and other neurodevelopmental disorders. And what makes CANDO particularly unique is our emphasis on and expertise in evaluating comorbid psychiatric disorders in this population. And this is a frequent occurrence of psychiatric disorders such as anxiety, ADHD, and other behavioral difficulties. And we have the expertise to provide these evaluations and treatment for this population. So in addition to the psychiatrists and nurse practitioners that are in the clinic, we also provide a training environment for the child psychiatry fellows and psychiatric residents to learn how to help and work with this population. In addition to the child psychiatry fellows seeing patients for ongoing psychiatric medication management, we also provide a bridging clinic service for those kids referred from the McPapp Clinic, who evaluates kids throughout the central Massachusetts region with psychiatric disorders. And oftentimes they need a stabilization period to provide treatment until community providers are found. And so we provide that service for this population as well. And Mary Beth will talk about some of the other services that are available within our clinic.
So one of the unique features of our clinic is our interdisciplinary team evaluation. Many of you may have heard about it. It is the only team of its kind in the state of Massachusetts that includes a psychiatrist, occupational therapist, speech and language pathologist, and a family resource specialist. And it's also part of our training program, so we have multiple trainees at different levels of the programs that participate and observe this particular evaluation. And we prioritize taking complex patients to help provide diagnostic clarification and recommendations to the family and to you as providers. We also have a team for Fragile X patients, and we also have a really unique training program, but also evaluation clinic for children between the ages of birth and 5, and to help with diagnosing and providing services. We have a mood and psychotic disorder clinic. We also serve children with ADHD, and we have our family resource specialist who helps to provide resources to the clinicians in service of the families. And last, we have a licensed social worker who can provide short-term services as well.
In addition, we often receive referrals from specialty clinics within the UMass Children's Medical Center, including neurology, genetics, the sleep specialist, and GI specialist, and we frequently will make referrals to those specialties as well if kids need those services or those evaluations after our assessment.
One additional service that we recently were approved to offer are called self-pay services. And these are various services where insurance does not cover. So we have a number of different services that families as well as agencies and programs and schools can access so that we can share our unique expertise in ways that we otherwise couldn't because it wouldn't be provided by insurance.
And currently we are primarily taking referrals from primary care physicians within the UMass provider network. We also take referrals within the UMass Children's Medical Center from other specialties including neurology, developmental behavioral pediatrics, and genetics. We hope to expand our referral source in the near future to a broader central Massachusetts providers. And we hope to be able to inform you of that in the coming months. We also are very fortunate to be located within the umbrella of the Shriver Center, which is a unique research and service organization within the UMass Medical School. And we are able to provide families with opportunities to participate in research studies that they may qualify for, and we frequently will refer patients and families to these research studies if they're interested in participating.
And you can make referrals through Epic, or we have a form that can be completed and faxed to us. But we really encourage, if you're connected to Epic, to make the referrals through Epic. And we do our best to triage to make sure we're the right place for your patients. If not, we will direct them to a place that we think is a better fit. And what's really important to hear from you is what your clinical question is and how we can really help you. And we also have additional information about CanDo on the Department of Psychiatry website under CanDo.